The early warning signs of labour are so wonderful. I often say to my moms, if you suddenly want to clean the floor and tidy up the house, it's a sign that something impending is going to happen. Your body knows when you're going into labour. You feel almost different. You just have this expectation that something's going to happen. You don't feel like going out. You feel like nesting. I think that's perhaps the best word. You might get that nesting feeling. You then may run to the loo, and that's your body's natural way of getting rid of anything that's in the bowel. It's that hormone reaction. So moms who are having a little bit of diarrhea, and then when they go to the loo, they see almost a mucousy discharge. That is called a show. And that's really the cervix, which is at the top of the vagina, the bottom of the womb, that is preparing for birth. When you see that show, it is very, very distinctly different to your normal discharge. It's often a silvery color, sometimes streaked with a little bit of blood, and it's almost a globule. You will not question yourself because it looks different to what you've usually seen. When you have the show and a bit of diarrhea and that feeling something's going to happen, you would then probably let your midwife or hospital or doctor know that you're showing signs of early labor. Now, the amniotic fluid that's surrounding the baby is not quite like in the movies. You won't be at the shop and suddenly have this gush. It could happen, but rarely. Only 40% of women, their waters rupture or that amniotic fluid leaks out before birth. So that is not a definite sign of labor. If that happens at any point, you need to let your caregiver know, because a woman at 25 weeks or a woman at 39 weeks, we would want you to deliver within 24 hours. We don't want you to have a delay because of the risk of infection. So the time that you do need to go to hospital is if your membranes have ruptured, and if you notice the color should be a straw-like color. It should not be dark brown or bloody. That is a danger sign. When it's dark brown, we say that the baby may be in distress, maybe, and pooed in utero. And that is a sign that you'd need to go to hospital. So the early signs of labor are, as I've said, the show, a bit of diarrhea, that feeling something's happening, and sometimes a little bit of almost discomfort around your middle. And those contractions that you're getting, the only sure sign of labor would be if those contractions are close together. So if you're sitting with your timer and you're in early labor, it can take anything, 7 to 8 hours. Some moms have a day or two of early labor. If you are sitting with your timer and you press it on, and there's 5 to 20 minutes in between, and it goes on like that, that's early labor. It's only when the contractions become closer together, where they're 3 to 5 minutes apart, or 2 to 3 contractions in 10 minutes, that we say you're in active labor. It's definitely happening. When you are at home and you're wondering when to go to hospital, the absolute definite time to go to hospital is when the contractions are 5 minutes apart. You do not stay at home during active labor unless you're planning a home birth. You also go to hospital immediately if you're bleeding, or if you go immediately into active labor, where the contractions don't start off with that early labor, where you've got time to move into it becoming closer together, but you suddenly start off with a contraction 2 to 3 minutes apart. You'd need to make your way to hospital. A lot of moms are very confused between Braxton Hicks, which is really not labor. It's the uterus preparing for labor. It feels a little bit like labor, but the difference being, and it's a very big difference, your Braxton Hicks contractions come and go at irregular times. You might get one at 3 o'clock and another one at 4:30 and one at 20 to 5 and then one at 6. There's no set rhythm or pattern. They are irregular. In that case, when you do have a Braxton Hicks contraction, or that feeling that there's sort of something happening and you're wondering, what is this? Go and take a bath, and if it disappears, you know that this is not truly labor. True labor will start and continue on a trajectory that is very definite. Your timing in between contractions will become less and less. The intensity of the contraction will go from 35, 45 seconds to 60 seconds. So stronger contractions, longer contractions, with shorter intervals in between, definitely labor. You need to get your way to hospital. Don't panic. Labor is not a sudden emergency. Unless you're bleeding, then you would call an ambulance or get to hospital if you're close as soon as possible. But there's no reason for you to panic in labor, because the average labor will take 12 to 16 hours. When we say average, we're not saying you're average. You are not a textbook, but we know that the cervix needs to dilate 10 centimeters to be fully dilated. So 1 centimeter every hour and a half would be considered quite a good benchmark. And some of us are different, and it may take a bit longer to dilate. What will help you to dilate quicker will be if you have a doula, if you remain calm, if you feel safe, and you trust your care provider. And that's why it's so important to get those things sorted out before you actually go into labor. A doula is the most marvelous person to have during your birth, whether it be cesarean section, home birth, or hospital birth. It is a person who has really put their heart into birth and into helping you have a great birth experience. They do not replace your doctor or midwife. They are not clinical or medically trained. They are, perhaps the best way to explain it is they're there for you from the waist up. Emotionally, mentally, spiritually, if you wish. They're there to help you with coping mechanisms so that you can get through the birth knowing that you've got this personal assistant by your side that's in it with you. And they are so, so wonderful. In fact, research has shown that doulas can decrease the chance of you having interventions, cesarean section, episiotomy, vacuum, forceps, etc., and a traumatic birth, simply by being present, that you know you have someone looking out for you. Not that the doctors aren't, but they're often very busy seeing that they give you the best care to deliver your baby, and if anything changes, to go with the baby. So the doula will always stay with you. They usually offer you a home visit before birth, so that you get to know them and see if they're a good fit for you. You really need to be comfortable with your doula and know that it'll be okay to have them there, and you feel that there's someone you can share this experience with. Another great reason for having a doula, besides their support and care during the birth, is the aftercare, which is so vital. It's not in hospital, but when you go home, they often do 1 or 2 follow-ups included in their package. The first birth option would be your natural vaginal birth, and this is very often what most mothers do opt for. It is really where the baby is coming through the birth canal, delivered through the vagina, and usually, statistically, we say that the majority of moms can give birth this way. Currently, the World Health Organization puts the stats for cesarean section as being safe at 18 to 20%. Worldwide trend is that Caesars have increased exponentially, to the point that natural childbirth has become a little bit looked upon as, oh my goodness, are you having a natural birth? That if you are choosing a natural birth, you need to know the benefits. And the benefits of a natural birth to you are, first of all, a quicker recovery time. You're able to get up straight afterwards, you're able to do things for yourself, and less medication in your system usually. So you can go on to breastfeed much more, I should say successfully, if you've had a natural birth, as opposed to a Caesar, where you would have a lot of drugs in your system and need help with the first couple of times latching, etc. So a natural birth has advantages in that you're able to breastfeed a lot quicker and usually much easier, because you've got that oxytocin levels. You are able to put the baby on and feed more successfully due to the fact that you've got these hormones floating around from the natural birth, especially the endorphins, which if we could bottle it, we would all be on a permanent high. It is the biggest high ever when you've given birth and you've got that surge of endorphins. You feel so good. You feel you can take on anything. For those moms who are planning a natural birth, the benefits to the baby, of course, are huge. As they come down the birth canal, they are not only seeded by you, and if you're interested in looking at a movie called Microbirth or taking it further, have a look at the microbiome. The baby is made up of parts of you that when they come down the birth canal, they are so protected by being delivered that way that their immunity is often stronger. Their sucking reflex is stronger, and of course they've got less fluid on their lungs because they're able to expel any excess fluid by that tight fit as they come down. Babies are more alert when they're born naturally, and for the moms it's easier to have that attachment. We do see less postnatal depression with moms who have had a positive birth experience, particularly a positive natural birth. Water birth is an amazing way to deliver your baby. However, you need to be certain that your care provider is experienced in water birth. Many of the medical students today don't have training in water birth. So if your care provider is not experienced in doing them, I would not advise you to have one. Secondly, water births are considered a very safe method of giving birth, providing the mom is in good health, and good health really means she had a pregnancy with no complications. She is of not necessarily average weight, but not obese. And during the labor, she has not been given medication. She was able to get in the bath physically and out. Water birth has got many great advantages, not just for the tissue stretching, so less chance of tearing, but also for the mom, for relaxation and to help her to manage the pain during birth. Being in the water, that being submerged almost takes away a lot of the contractions pain. They're less intense. Also, being in the water, when the baby is born, they are born from a water-filled environment into a water-filled environment. They don't take their first breath until they're out. So it's a very safe way, providing that everything goes smoothly. So if at any point you're asked to get out the bath, you need to do that. And if you're needing medication, you need to come out and have the medication and be monitored. When you're having a water birth, you are monitored just as closely. You need to make sure that the person doing the water birth has a water, a machine that can hear the baby's heart rate and that can go into the water and be immersed without breaking. You also need to be sure that the bath is cleaned really well. There is a small risk of infection, like with anything. We need to be certain that that bath has been cleaned. And the temperature of the bath should be at about 36 to 37 degrees Celsius so that the baby is not born into something cold. And then we would like you to get out the bath to deliver the placenta. So the advantages are huge, providing you fit into that group of women who have no complications during their pregnancy. Home birth today is considered very safe, if not as safe as a hospital birth, providing that the person who you've chosen to be with you at the home birth is an experienced midwife, well-trained, well-respected, and has a gynae for backup. So your gynae obstetrician needs to have a relationship with that midwife in such that if things change and you need to be taken to hospital, that you've got someone to meet you there, should you need to have a cesarean section. The majority of home births will only be allowed if the mom, once again, is in good health, has had no complications during her pregnancy, and has a good support team. And then home birth is an excellent option. Make sure that you've got all the numbers on the phone that you need in an emergency. See that you've got the equipment set up. And once again, having a doula, even with a home birth, would be a massive benefit. Should things change, your doula can go ahead and pack your things, meet you at the hospital, let your family know. So as long as you have a good support team, a home birth is perfectly safe. A cesarean section is today considered very, very safe surgery. Like all surgeries, it does carry some small risks, and those risks would be infection, which we do actually cover now. In theatre, most women are given usually an IV antibiotic in the theatre just to protect against that. Secondly, the risk of bleeding is definitely there. If you're taking any blood thinning medication, you need to let your doctor know. That would help to minimize that. Thirdly, the risk of trauma to the bladder and bowel. There's a small chance that the doctor can nick the bladder or bowel during surgery. And of course, with any surgery, there carries the risk of the effects of the anesthetic. So if you're having a spinal, which is really like an epidural, but a once-off dose of medication, and for any reason you are very anxious or things change and you need to have a general anesthetic, that does carry some risk with it as well. The good news is that in today's modern world, there are far more cesarean sections being done than ever, and more than likely your gynae obstetrician is extremely well qualified and experienced to carry them out. The incision that they make for the Caesar is literally just, if you take your middle finger and go maybe a centimetre or two below it, that big. And it's made really where your bikini line is. Today, they often use a continuous suture, no longer big staples, and they're very aware of minimal scarring, and they take their time to do the best job that they can. So cesarean section, while being a big operation, tends to be quite mainstream today. The way to prepare for a Caesar is to make certain that you have all the support around you afterwards. It does carry a longer recovery time. No driving the first 2 to 3 weeks, sometimes longer. No heavy housework, picking up things. Absolutely, your job is to rest and to feed the baby. Once the baby's born, you'll be given an injection that you won't even know you've been given of synthetic oxytocin, syntocinon, which will be given into the thigh to help your uterus contract. You still need to deliver your placenta. This marvelous organ that's been giving your baby life and all the nutrients is still attached to your uterus. So once the baby's out, this is the cord that's still attached to the baby, and what we like to advocate for today is delayed cord clamping. If you can chat to your doctor and midwife about letting this cord pulsate, anything from 1 to 3 minutes, so that all the oxygenated blood can pump through these 2 veins and an artery to your baby at birth, that'll be amazing. The benefits are huge. It's the one chance that your baby will have to get this blood is in those few minutes after he's born. So delayed cord clamping is really just about giving the baby an opportunity to be on you skin to skin with no interruptions, and you will actually see the cord pulsating. It looks like, almost like jelly. It's very gelatinous and hard to cut through. And ask your partner if they're keen to cut the cord, because when those 1 or 2 or 3 minutes are up, providing there's no emergency, then your partner can actually cut the cord, and you will then need to deliver your placenta. Once the cord is cut, the placenta is still inside the uterus, and this cord will be hanging down. Your doctor or midwife will then let you know that we need to deliver the placenta. They'll ask you if you could take probably a deep breath and push, or if you can try and help them, and you might feel a little bit of tugging. You could feel a little bit of pressure down below, and that's really just the placenta coming away and being delivered. Once the placenta's out, your doctor or midwife is going to examine it to make sure that all the parts are there. This is crucial. We don't want you going home with any little bit of placenta left behind, because if you go home with that, the body recognizes it as a foreign body, you develop infection and flu-like symptoms. So if you do go home and start bleeding heavily later on and have flu-like symptoms, you need to go straight back to your doctor. There is a risk that exists of placenta being left behind. Once the placenta's out, they will ask you, would you like to keep it, take it home? Some cultures do take it home. It is very important in certain cultures. It's considered sacred. In some people who have heard about encapsulation, it is not evidence-based, but there are some studies that have shown moms have taken the placenta and had it dried out, and they take it as a capsule, so they re-ingest the placenta. Not mainstream at all, but just so you're aware. Most hospitals will incinerate the placenta. If you, for any reason, have had a problem with your pregnancy or a difficult birth and you're looking for some answers, they may ask, would you like to send the placenta off for testing or so? Just really nice to know. Straight after birth, the baby will come to you. It will have thick white vermix on, not always thick, but it will have a layer that looks almost like white patches. And that layer is so important because it's protecting your baby's skin, and it's very high protein. If we could bottle it and put it on our skin, it would be worth a lot of money. So keep that vermix on your baby. Keep your baby close to you. Don't put a cap on your baby's head. It's good to smell your baby. It sets off your endorphins and oxytocin levels beautifully. And for the baby sucking reflex, which is there already, and they are physiologically wired, they're born to suck, you will see them probably trying to get to the breast if they're crawling, or if they're close, you might see the mouth moving like this, and you might see them looking around. And there are quite instinctive stages that the newborn baby goes through. You don't need to worry about those stages. Your job at this point is really just to enjoy your baby, keep them close, and while you're keeping your baby close, your doctor or midwife will be examining you to see if you need any sutures. If you do need suturing, stitches down below, you don't need to be scared. They will always local the area first. You might feel a slight burn, but because you're so happy that this baby's born, you don't even think about it. Your doctor or midwife will suture you beautifully. They follow the line up. You do not get sutured smaller, and you do not get left bigger. You get sutured as you were. The vagina is a muscle, it will heal. They will then very often put their finger in your bum, which you're least expecting, to check that there's no tears that have gone through and to make sure that you have had no injury to the anal area. Because it's so close, they want to be sure that everything's in working order. Sometimes they will give you a suppository. They should always ask first, but that's just to help with the swelling, to decrease. And they should always give you a perineal ice pack. It's not their vagina, so they sometimes forget, but on your little birth plan, you could write, please could I have an ice pack as soon as baby's out and you've been stitched. When the baby stays with you, that is be the perfect beginning. You do not have to latch the baby instantly. You can get to know your baby, have a look at your baby, smell your baby. If you're unable to do that for any reason, let your partner do that. It's perfect opportunity for your partner to take his shirt off and keep the baby close. You may feel that you want to go and have a bath and you'd like to perhaps have a little rest. You're really, really tired. It's almost like running a marathon. You've done a tremendous amount of work and your body may feel tired. Most of the time after a normal vertex delivery, a natural birth, you feel high. You feel you can do anything. And this is why we like the moms to avoid as much as possible having too much medication during the labor so that they can recover well and breastfeed from the beginning. You'll more than likely be taken to your room, and during that time, the nurses will come and check at least every half an hour that you're not bleeding too much. You can expect to soak through the pad, but you should not be bleeding down your leg through the pad, or when you stand up, if there's any blood that's flushing down to the floor, you need to ask for help immediately. So some heavy blood loss, very red in the first few days, should be decreasing, not increasing over time. Some moms can bleed up to a month, 2 months, it varies. We would, however, expect that if the bleeding is heavy on the day of the birth, that slowly over the next few days, that bleeding would decrease from dark red to a lighter color and then a brownish color. So when you come for your 6-week checkup, you can let your doctor know, or your midwife, exactly what's been happening with the bleeding. It tells us a story. And your uterus will be quite high, almost like a ball above your umbilical area. And slowly, as you breastfeed, one of the benefits of breastfeeding is your uterus slowly goes back down to size. So when you do go to wee, or to the loo, I would suggest that you actually massage to get rid of any excess blood or clots that are sitting inside the uterus, and just to help it go back down. And that's one of the reasons we say to the moms, when you breastfeed and you have a letdown, it's that release of oxytocin that helps the letdown, same hormone involved with orgasm, same involved with birth, then your uterus very often will contract. So you can expect the first few days, sometimes longer, to actually have this strange, almost cramp-like feeling. And you think to yourself, I've given birth, why am I having contractions? But it's your uterus way of going back to shape and of expelling any excess blood. So you can expect that when you feed. We don't recommend any immediate tests unless, in the case of emergency, you can ignore everything I say. So, of course, when a baby's born, we do routinely do an Apgar test. So, in terms of testing, the Apgar is probably the most important score that your baby would get. And that is simply us having a look at your baby and giving a score out of 10 in the first 1 minute. That gives us an indication. So, we're looking at respiration, color, reflexes, breathing, crying, and we would then give your baby, for example, 9 out of 10, because at birth they still need, once the cord's cut, we need their heart to kick in and start pumping that oxygenated blood to the extremities. So you will find at birth that the babies are often a little bit blue. It's quite frightening to see. So their arms and hands and legs, all their extremities are blue. So 9 out of 10 would be because we gave just a little bit less for that blueness. And once the heart kicks in and takes that oxygenated blood around the baby's body, you'll see at 5 minutes we'll do the Apgar score again, and it will probably be 10 out of 10. A baby who's very flat and not responsive and blue, quiet, those babies get very low Apgar scores, usually 2 or 3 or 4. They will need to be taken to the either ICU or to the side with the pediatrician and the nurse from the ICU to help resuscitate, or to bring the baby back so that we can have an Apgar of 10 out of 10, hopefully. The first Apgar is the one that everybody often will be holding their breath for, but the one that I'm most interested in is the one after 5 minutes, that the baby has responded and is well and healthy. Some of the times we see a low Apgar simply because of the effects of the pethidine given that have crossed the placenta to the baby, and in that case we would expect the baby to pink up and wake up beautifully once we've given the Narcan to reverse the effects. In some babies, when the Apgar remains low, it could be some concerns around the lungs, particularly wet lungs or underdeveloped lungs, and occasionally infection. Those babies may need to go straight to the ICU. What we can expect is that when the Apgar test is done, that we would write that down, and that Apgar test stays for life. So we will always try our best to get the best Apgar. You don't need to be concerned about that. In other words, your main concern at the point of birth will be to get your baby to you and to hold it and just savor and enjoy that moment. No, they don't all cry. Some babies do cry, and everyone is very relieved and happy. Obviously, a baby that cries, great lungs, telling us it's there, is wonderful. Some babies are very quiet but alert. They're healthy and they're well. They simply are quiet. That's how we're all different. Those babies that are born quiet, we may just wait a bit for a cry. You might see a little bit of rubbing of the body with a towel. They may wish to take the baby just to check under the lights. But usually babies do make a little bit of noise when they're born. What you need to be aware of as well is that your baby will be given an injection of vitamin K. This is to prevent any bleeding problems, and it is a standard procedure in most hospitals. It is, in fact, considered necessary to give it. So if you're on that sort of path where you feel very scared to give your baby anything, just know that this is helpful and well researched. Today, a lot of moms are asking what would happen if they had a Caesar with their first baby and they really wanted to experience a vaginal birth with their second, or even third, not always second. Those moms need to be pointed in the direction of a gynecologist or obstetrician who is experienced in VBAC births. There is, of course, with everything, a small risk, and that risk is there. It is something along the lines of 0.0, I don't know exactly, but it is not high that the uterus can rupture, especially if the second or subsequent pregnancy is close to the first one, or if the third pregnancy is wanting to have a vaginal birth and the first two are Caesars. You need to have had a healthy pregnancy. The reasons for the Caesar first time round are simply that the baby was big, or you had a long labor, or we were a bit worried, or we chose a Caesar because the doctor's going away. Any of those sort of reasons that are non-medical, we would say that there is an opportunity for you to have a VBAC, providing that your pregnancy has been going well and that your doctor is happy with that decision. Most VBAC births would take place in hospital, simply because of that small risk of the uterus rupturing. We also know that round about something like 60 to 70% of women who have a VBAC or attempt a VBAC are successful, only if their care provider is experienced with VBACs and they've set themselves up with all the things that we've discussed before. They're not fearful, they've done good antenatal, they have a doula, they have great support. When it comes to making a choice around birth, you need to do what feels right for you, first of all. Secondly, you've got to do what's safe. And thirdly, make sure you surround yourself with a person who shares your wishes for natural birth or Caesar or midwife birth. This is the crucial part. All births are beautiful. All moms, no matter how they give birth, are superstars. You're a great mom, whether you give birth in the sea, at home in the bath with a good midwife, in hospital, drugged up to your eyeballs. What determines you being a good mom is not how you gave birth. It's the love and time that you give to your child. So please, if you've chosen a birth option and it goes slightly off course to something that you least expected or you were hoping not to have, it's okay. You're still a great mom.